Good afternoon, everybody, and welcome to the NNLM Region 6 update. My name is Linda Walton, and I am the Director and Principal Investigator for the region. The agenda today will include meeting Region 6 and the staff, Year 2 highlights, and Year 3 plans with Q&A. The NNLM operates on a fiscal year that begins on May 1, so this is great timing for us to give you this quick update. The Region 6 is comprised of 7 states in the Midwest: Illinois, Indiana, Iowa, Michigan, Minnesota, Ohio, and Wisconsin. The region has 623 counties and a population of over 56 million people. It expands an area of 378,385 square miles. Our region has 1,234 members, and they are comprised of health sciences and public libraries, public health departments, and community clinics, as well as nonprofit and faith-based organizations. The 7 members of our staff include Bobby in the upper right-hand corner. She focuses on public libraries. Then we have Miles, who handles communications and finance. Erica focuses on academic and health sciences libraries. Darlene focuses on community outreach and sub-awards. Jacqueline handles membership, DocLine, the website, and the POP program. Nora is our health professionals coordinator, and then me. Later in the presentation, you'll hear from our staff about plans for Year 3, with the exception of Nora, who was not able to join us today, but her projects will be represented. Okay, let's get started with Year 2. Our highlights: it was an incredible year, and it would not have happened without the staff and all their hard work and you, the members. A little bit of repetition from Martha's presentation, if any of you attended that. But one of our biggest accomplishments this year was the Health Misinformation Symposium. It was an NNLM event, but Region 6 was the lead coordinator on this. It was held over 3 days in April 4 through 6. There were 3 keynote speakers and 31 papers presented. 1,756 attendees registered, 1,756 registrations with 771 unique live attendees. The symposium was we just had fantastic reviews about the symposium. And if you couldn't attend the sessions, you can see presentations on the NNLM YouTube. The first ever NNLM podcast series launched this year. The series explores how the NNLM is engaging with communities to provide access to trusted information. Each region selected an outreach story to feature. Along with the podcast, a video series was developed. These can all be found on the NNLM YouTube channel. The podcast, I believe, you can watch on your favorite podcast access. Our particular podcast featured the work being done in Ohio to address period poverty. You can hear Miles talk about the project on the podcast and see Darlene participating in the accompanying video. A second. This year, we funded over $100,000 worth of awards to network members. Topics range from MPOX to pediatric dentistry. 3 of the projects can be used by other network members, including the multilingual resources that are social media slides, public service announcements, and patient education materials. The EBM training for nurses is an open access module with CNE credits available for Illinois nurses. It can be taken by anyone, but just for the continuing education credits, you have to be a nurse in Illinois. Links to these resources can be found on our website. The next 3 slides, I just want to show you some examples of the multilingual tools. The social media and public service announcements are in English, Hmong, Somali, and Spanish. The slides can be used on your Facebook or Twitter accounts or in in-house media screens, things like that. The link in our website organizes the social media by subject, so it's easy to find media on your topic of interest. And I want to say there are 64 topics, but I'm not positive about that. But anyway, this is what a slide looks like. And they're just really beautiful. This is an example of a public service announcement. They're all 30 seconds long. This particular one is in Somali, and we're going to try and play it here.
waxaad hoos u dhigi kartaa halista qaadida cudurrada halista ah adiga oo ku noolaanayo nolol caafimaad leh ku dhaqan cadyoonkan caafimaadka leh dhaqdhaqaaq jirkaaga ugu yaraan 30 daqiiqood maalintii cun miraha iyo qudaarta maalin kasta oo ku dar borotiin cuntadaada hurud 8 saacadood habeen kasta raadso dhaqdhaqaaqasho oo bulshad oo caafimaad leh oo u tag dhakhtarkaaga caafimaadka si aad kugu sameeyo baaritaanada sanadaha leh ka baro sidii caafimaad leh lagu noolaanayo medlineplus.gov.
So I just think those are beautiful, and I hope people can take advantage of them. We just got a report back from the organization that did these public service announcements for them, and I believe the most popular one was depression in the Somali language. So anyway, just great videos. Finally, we funded the Health Information Translations Project. This is a website that has 3,500 health education resources in 20 languages. We gave them funding. This has been around for a while. We gave them funding to update the website. Popular topics, they say, are car seat safety, feeling sad, and hand washing. So these can be downloaded. These are education, handouts that can be downloaded and handed out, or you can provide this link to your health professionals. The Partner Outreach Program completed its second year with 39 activities and over 1,400 participants. We currently have 15 organizations with at least one POP in each state. Activities this year included presentations to national and statewide groups, health information specific to LGBTQ plus organizations, presentations to statewide library conferences, and health information outreach at African American festivals. We're thankful for the work of our POPs in their communities. We would not be nearly as successful as we are without them. This year, our staff taught 11 classes, reaching over 1,500 people. And additionally, 1,400 presentations were given at staff days, state, regional, and national conferences, reaching over 700 people. Finally, our Speaker Spotlight series reached over 900 people with 9 webinars offered. Experts presented on topics such as environmental studies, mental health care, health literacy, trauma in public libraries. If you know of interesting research going on in your university or your hospital and would like to see the subject highlighted in the webinar series and your researcher or clinician, please reach out to us and we'll see what we can do. So that is a quick overview of year 2. And now I'd like to turn over the presentation to the staff. They can tell you about some of their projects, classes, and programs being planned for next year. Starting us off will be Jacqueline to talk about membership and partnerships.
Thanks, Linda. If you've been following along with our membership numbers, you may see that our numbers are decreasing while at the same time we continue to add numbers. Region 6 added 35 in year 2. We have made a concerted effort to reach out to those members whose connection with NNLM has faded through the years, whether because the organization no longer exists, or in the case of many hospitals, the library no longer exists, or perhaps the contact liaison has moved on. If we're unable to find a connection, those members have been canceled. As Linda mentioned, in October of 2021, we launched our current POP, or Partner Outreach Program. We started out with 16 ambassador organizations, moved up to 17, and then settled on our current 15, with at least one NNLM organization from each state. POP consists of public libraries, academic health sciences libraries, and no libraries with our CBOs and FBOs. With POP and membership review, we hope to bring together those organizations who are in need of our resources and those who know how to share them. Each one of our POP organizations knows their community and exercises their community connections to improve health information access by promoting NLM and NIH resources and NNLM. In year 3, we will focus our membership campaign on community centers. If you look around your community, what do you see? Community members, next slide. Thanks. So if you look around your community, what do you see? Community centers whose members are underserved or underrepresented. Perhaps tribal organizations or minority populations establishing communal support. When we first designed POP, we considered them as a field force to identify potential partners for outreach. Happily, POP has evolved into quite the force, reaching out into their communities, and now we have room to grow. To learn more how we can maximize POP outreach, we sent out a brief survey in year 2 to evaluate POP and are in the process of analyzing the results so that we can maximize their effort. Coming year 3 will be a focus group of POPs. We want to know what they've learned over the past year and a half and how we can support them, and possibly you in your outreach on behalf of NNLM. If you would like to be considered for POP, please contact Region 6. Each activity that is performed receives either a flat $300 or a negotiated stipend. If you know your community's best, and we would like to make sure that they can become an active member of NNLM. So as I mentioned above, our membership is very important to us. By having accurate roles and current contacts, we can best serve our constituents, know their needs and priorities. Community centers, our next focus for year 3, are public venues where community members go for a variety of reasons, including socializing, participating in recreational or educational activities, gaining information, and seeking counseling or support services. Community centers can be run by the government, by a local nonprofit, or by faith-based groups. Some of the advantages of participants in community centers are improved social networks, reduced isolation, improved well-being, and we still look forward to adding more types of organizations that support the NNL mission, such as public libraries. Next, please. Thanks. We set up 7 advisory groups, our state advisory group members, and they spent year 2 discovering and developing plans from mental health to menstrual health and dental health. We are funding these state action plans for $10,000 each, and here is a bit about each one. In Illinois, the Illinois SAG has designed an outreach award to meet the needs of Illinois constituents. We are currently accepting applications through May 15th. Iowa's Community Partnership for Mental Health Initiative aims to achieve 3 key objectives. First, it focuses on developing a comprehensive toolkit as a valuable resource for promoting mental health in communities. This toolkit includes a user-friendly website guide on nnlm.gov and customizable bookmarks with local information. It's a concise 1-page guide for quick reference, programming ideas, and training materials for library staff. Indiana partnered with Dr. William Cook, a physician and author of Canary in the Coal Mine, to publicly engage with communities throughout Indiana for addiction and recovery information. The objectives are to raise understanding for the social determinants of health that contribute to substance abuse, explain interventions such as harm reduction that can lead to clinical treatment and recovery resources. And third, to help individuals and communities respond compassionately for persons living with and recovering from addiction. Michigan focused on mental health. Promotion of Michigan's advisory group will be developing a mental health resource kit to support NNLM member libraries across the state. The kit will provide guidance for librarians, library workers, and frontline staff on how to effectively address mental health instances in their libraries and aims to increase their comfort level to respond to mental health needs. Minnesota's advisory group will partner with the National Alliance on Mental Illness, Minnesota, to promote awareness of mental health resources in the state. The group will leverage their extensive community ties and relationships to broaden the reach of a crisis resource handout and oversee the translation of the handout into Spanish, Somali, Hmong, and Ojibwe. Ohio partnered with Ant Flow, a Columbus-based nonprofit, to develop culturally and age-appropriate health information to educate about period poverty and menstrual health. The goal is to provide the toolkit to public and school libraries and community health centers throughout the state. Wisconsin looks forward to partnering with Wisconsin Health Literacy and the Wisconsin Dental Association to raise understanding for dental and oral health, such as finding insurance, locating providers, and understanding the importance of early childhood oral care. Thanks, and now I will hand it up to Bobby, Darlene, Erica, and Miles.
As part of our comprehensive outreach strategy, I'm excited to host 3 town halls that directly engage with public libraries in our 7-state region, including complementing the efforts of our state advisory groups. These town halls will serve as a platform for sharing crucial information about resources, training opportunities, and funding that are available to all public libraries from NNLM. More importantly, these sessions provide a unique opportunity for public libraries to provide feedback, suggestions on how Region 6 can effectively help public libraries meet the health information needs of their communities. These events will be divided into 2 halves, ensuring an interactive experience for all participants. In the first half, I will highlight the role of Region 6 of NNLM in supporting public libraries, helping the attendees to discover the diverse range of resources, educational programs, and funding opportunities for public libraries through NNLM. This segment aims to empower public libraries in meeting the specific health information needs of their communities. The second half of the town hall will be dedicated to open dialogue. Public librarians and staff can ask questions, provide valuable suggestions, share feedback, and engage in brainstorming sessions centered around health-related topics. These town halls will allow Region 6 to hear directly from public libraries about the webinars, resources, and additional services that would significantly benefit them. And of course, these town halls will help increase membership. Next slide.
We'll also be connecting with hospital and academic health sciences librarians in the region through 2 structured listening sessions in June. We conducted these last year, and they were really informative and enjoyable conversations. We learn what's challenging and inspiring you these days, and we get to hear about your experiences and needs related to NNLM education, engagement, and funding. We'll use the feedback we receive to inform and improve what we offer in the region this year. And then we'll take information from those sessions and share them with other network staff when we're developing new national classes. Our in-person site visits with tribal college librarians in the region will continue this summer with 3 stops planned for Michigan and 1 for Wisconsin. New this year is our service on the Native Health Database Advisory Council. In this role, we'll represent the region while engaging with national audiences on Native American health, and will identify collaborators in Region 6 who might have original content to submit to the database. We'll also continue our virtual visits with library and information science programs this summer. A few of the programs in our region are either considering or are currently developing new health science librarianship curriculums, and it's exciting to lend our support to this work. We are also talking with faculty and administrators about NNLM's Consumer Health for Library Students program, which guides LIS instructors through getting their health science courses approved as an MLA consumer health course. And in March, we hosted our first LIS student for an alternative spring break experience. And our students spent a week working with us virtually on a community outreach project. We would love to offer future student practicums and engagement opportunities, so please reach out to us if you'd like to partner on a project, or if you know of a student who's particularly interested in health sciences librarianship. If you attended our Health Misinformation Symposium in April, you may be interested in keeping the exploration and conversation going by attending our Health Misinformation webinar series. These webinars will feature guest speakers presenting on various aspects of health misinformation and offer practical and evidence-based solutions for how to identify it and help curb its spread. We kick this series off in April, and webinars will be scheduled intermittently throughout the rest of this year. Some of the upcoming sessions are shown on the slide, and you can check out the NNLM training calendar or follow our newsletter, blog, and social media posts to get details on future sessions.
Environmental determinants of health, or EDHs, encompass various external factors that can impact human health, including physical, chemical, and biological elements and related behaviors. These factors collectively play a significant role in shaping the health and well-being of individuals and communities. EDHs can arise from natural occurrences, human-made conditions, or social circumstances and lifestyles. It is critical to address these environmental threats as they directly affect the population's overall health. The NNLM recognizes the importance of enhancing NLM's members' knowledge and understanding of EDHs. This initiative will provide comprehensive coverage of a wide range of topics, including socioeconomic factors, natural and built environmental influences, pollution, climate change, disaster information management, mental and emotional well-being, rural and urban health considerations, tribal health disparities, access to healthcare, health advocacy, and sustainability. By delving into these areas, the NNLM aims to establish a foundational understanding of EDHs among its members and contribute to improving public health outcomes. In year 3, Region 6, in partnership with other regions and offices across the country, will launch a webinar series dedicated to exploring the various aspects of environmental determinants of health, providing valuable insights and resources to the community. In addition to the webinar series, Region 6 and NNLM will host a book discussion on environmental determinants of health. By offering this platform, we hope to encourage dialogue, awareness, and understanding of how environmental factors such as air quality, housing conditions, and access to green spaces significantly impact health outcomes. Next slide.
Region 6 is working with other regional libraries and offices to plan an NNLM disaster preparedness event for September. We're currently developing this, and it looks like we'll offer 4 to 6 webinars spread out throughout the month that will be on disaster preparation, response, and recovery with a focus on community resilience. The topics that we're considering right now are extreme weather events, healthcare system preparedness, and disaster data. And Region 6 is involved in developing some terrific new national classes for you this year. One will be for librarians who support researchers in submitting their publications to comply with NIH public access policy. Much of the instruction and training that's currently available out there is geared for the researchers themselves. So this course will offer practical guidance expressly for librarians and explain the NIH public access policy, the importance of submitting a manuscript, the steps that are involved, and how to determine compliance. We are also creating a new class on the use of NLM products in systematic reviews. This class won't provide any instruction on how to perform a systematic review, but instead will focus on how to document, save, share, update, and reproduce systematic reviews that are conducted in NLM products like PubMed and clinicaltrials.gov. Once that's developed, we're going to be submitting that as a course for the MLA Systematic Review Services Specialization.
Many of our members, including health sciences librarians and public librarians, value the information they acquire while earning their Consumer Health Information Specialization, or CHIS. During year 2, NLM staff from across the regions and offices collaborated to develop 5 one-hour on-demand Moodle sessions, one for each of the CHIS Level 1 competencies. During year 3, Region 6 will collaborate with staff from Regions 2 and 5 to develop 3 new one-hour on-demand Moodle classes for the CHIS level competencies 2. These classes should be ready to launch at the end of year 3, and this will allow members to acquire their Consumer Health Information Specialization on a schedule that works for them. These classes will cover Consumer Health Information Specializations competencies 6, 7, and 8. So 6 is health literacy and literacy, understanding the related issues of literacy and health literacy, and the principles and practices of serving users with low health literacy skills or low health literacy, including understanding and knowledge of appropriate print, online, and multimedia health materials. CHIS competency 7 is technology and health. Users should understand current technology used by patrons within and outside of the library, have a proficiency assisting users with library computers, the library catalog, subscription-based health information services, internet searching, and web-based health searches. Also, participants will become aware of emerging technology trends in health-related social networking, mobile access, electronic health records, and personal health records. And finally, CHIS level 8 is ethics and legal issues. Participants will help understand the ethical issues surrounding the provision of medical information, including the use of discretion and patrons' right to privacy. And just as a reminder, NNLM does cover the cost of requiring both your CHIS level 1 and 2 and renewals of your CHIS certificates. Next slide, please. Given the rising interest in complementary and integrative health, we will also be working to develop a new class on this topic with Region 6 and the National Training Office. This class will provide participants with essential tools and knowledge to assist patrons in exploring complementary and integrative health resources. Participants will be better equipped to critically evaluate complementary and integrative health and their resources, and assist patrons in locating services and resources in an increasingly integrative and patient-centered healthcare environment. By participating in this class, you will gain comprehensive understanding of the definitions and types of complementary and integrative health, allowing you to navigate the range of approaches and therapies in this field. Additionally, participants will delve into the history of complementary and integrative health and its relationship with Western medicine, enabling you to better appreciate the evolution and integration of complementary and integrative healthcare practices within our healthcare system. This class offers a deeper exploration of the usage and benefits and the risks of complementary and integrative health, helping to increase confidence in evaluating complementary and integrative health claims and resources. Participants will develop critical thinking skills to discern evidence-based information from misleading or unsubstantiated claims, ensuring that you can provide accurate and reliable guidance to patrons. We hope this class addresses the pressing need to enhance skills in avoiding bad science and misinformation related to complementary and integrative health found online or in the news, and also in social media. Participants will learn effective strategies to identify and evaluate reliable sources of information and become proficient in searching for evidence on the effectiveness of complementary and integrative health class resources. Next slide, please. In partnership with Regions 1, 2, and the National Training Office, we will also be developing a 1-hour webinar presentation class on resources for mental health at work. Participants in this class will become familiar with the Surgeon General's recommendations for improving mental health and well-being at work. This knowledge will empower individuals to understand the significance of mental health in the workplace and explore strategies to create creative and positive work environments. The class emphasizes understanding the 8 parts of SAMHSA's creating a healthier life, a step-by-step guide to wellness for individuals. By exploring these components, participants will gain insight into various aspects of well-being and learn practical steps to enhance their own mental health. Additionally, participants will be introduced to valuable resources from reputable organizations, such as the National Library of Medicine and the National Institutes of Health, and others that are specifically related to mental health and well-being. This knowledge will enable participants to access reliable information, tools, and services to support their mental health and that of colleagues, contributing to a healthy and more supportive work environment overall. By attending this class and achieving the outlined objectives, participants will be equipped with valuable resources and knowledge to foster mental health and well-being in the workplace. Next slide, please. As many of you may have participated in the NNLM book discussion last year, year 2, our very successful pilot year. Thanks to your feedback and suggestions, we're moving forward in year 3. The NNLM book discussion provides an opportunity for librarians, health professionals, public health workers, and others to delve into health issues that impact their communities. By participating in an online or a live discussion, professionals can earn 4 CE credits from the Medical Library Association at their own pace. Each quarter, we select a new book and participants have 3 months to complete the requirements. The NNLM book discussion program is designed to be flexible and respectful of participants' preferences by allowing you to earn your CE either through a live Zoom discussion or an online Moodle discussion. The program focuses on timely topics for libraries and selects books that are available in a variety of formats, including ebook, audiobook, and print. Additionally, the program selects books that do not have long waiting lists and are reasonably priced to make it easier for participants to acquire the book and complete the requirements in the designated timeframe. The NNLM book discussion selection criteria includes topics related to NNLM priorities, initiatives, target populations, and cultural awareness and humility. Additionally, the selection process may consider works that address topics and issues related to historically excluded or abused communities and populations. These criteria ensure that the chosen books are relevant and informative participants, as well as promoting cultural understanding and inclusivity. By selecting titles based on these criteria, the NNLM book discussion fosters education and engagement among library staff and health professionals while promoting health literacy and awareness of health issues faced by communities. And you can see the titles that we have selected for year 3 on this slide. Next slide.
Continuing on the topic of reading clubs, we have the NNLM Reading Club, which was initiated in November of 2018, and it selects 3 books each month to address a health topic. Now, this online collection has now grown to 31 health topics and 129 books, and it continues to expand monthly. For example, next month, we're going to feature LGBTQ plus health, and later in the year, we'll be looking at mental health and dementia. So, in order to wrangle all this content, it's a growing issue too. So thankfully, with the help of our national website office, the NNLM Reading Club Interest Group restructured and redesigned the NNLM Reading Club website for improved navigation and discovery of the books and health information resources. Now, the Reading Club continues to receive recognition as well. We've been featured in goodreads.com and referenced on several author websites. Additionally, we have a book chapter coming out in a soon-to-be-released MLA book. It will discuss the evidence-based approach of using book clubs to engage individuals and their communities in health conversations. So we always encourage our member libraries to discover a book, download the discussion guide, and get the conversation started with their local community, whether it's your public patrons or your nursing and medical students. It's a great way to discuss diseases and conditions and share accurate and reliable health information. And it may also help remove the stigma around sensitive topics such as mental health, trauma, or end-of-life care. We also have another course offering coming out this year in partnership with our National Training Office and our other regional offices. Region 6 has developed a new course called Telehealth 101, What Libraries Need to Know. Now, this is a 3-hour scheduled Moodle course. It's worth 3 MLA continuing education credits, and it also qualifies for the MLA Consumer Health Information Specialization. The class will introduce telehealth, why it's important, and how it enables people to have greater access to quality healthcare. It also explores how different libraries provide telehealth services. The class will address privacy and ethical concerns, and it will review the technology and infrastructure needed to launch a successful program in a library setting. You can go to our NNLM training website to register for this upcoming class and know that we'll be presenting at MLA next week. So please look for our scheduled presentation and come to that to learn more. Finally, the NNLM Telehealth Interest Group is developing a community of practice for our members and developing a webinar series. So look for more information to come this year. Many of you, I hope, are familiar with this toolkit. In our effort to instruct and engage communities for health-driven research and outreach, we encourage our members to use this community guide to advance health information equity. You can find a link to the tool from our nnlm.gov/Region 6 homepage. Now, if you haven't used this toolkit, know that it is an interactive resource to facilitate awareness of the evidence-based health needs within our 7 states. And the purpose is to support the NNLM mission to improve access, use, and understanding of health information from the National Library of Medicine and other trusted resources. Now, each state has 9 county stories that describe community health needs. And we tell the story through publicly available photos, data, and maps. So if you want to learn more, check us out. And also, I'm happy to offer a 20-minute virtual presentation to any group who might want to learn more about this toolkit. I can present to librarians, students, anyone. So just contact me via email. Now, to date, we have 63 county stories, but for year 3, we want to add more. We'd like to at least add 1 new story to each of our states. And we'd like to do this with the help of our members like you. We want to learn what stories. We want to hear your stories that are capturing the positive work being done to improve health literacy and digital access. So you can contribute your story by using the QR code that you see on the screen. Now this spring, we already did announce our 2 health information outreach awards of up to $15,000 and 1 for $10,000. We received 10 competitive applications. They're aligned with our NLM mission and our NNLM priorities and objectives. We ultimately selected a library telehealth project for a rural community, a digital literacy project for an underserved urban population, and a mental health partnership with a faith-based organization and the National Alliance on Mental Illness, NAMI, of Southwest Ohio. So we are looking forward to their accomplishments and their deliverables in year 3. Thank you. Miles?
Yeah, and I'm going to wrap up our presentation with some communication enhancements and how to keep in touch with Region 6. New to year 3, we have some improvements to our blog. You can now subscribe to get email notifications when a new post is published, and there will be a subscription box on the blog and on every post. And we are also going to start doing monthly posts that focus on themed health topics. A good way to stay in touch is through our email newsletters. We have a weekly email digest that goes out Fridays that has upcoming webinars, news, resources, both across Region 6 and nationally. And we also provide 3 targeted email digests as well, and those are monthly, and those will focus more on the 3 topics below. We have an academic and health science libraries newsletter, a public libraries newsletter, and a health professionals newsletter. And here is how you can find us online. We are on Facebook and Twitter. New for year 3, we are on LinkedIn. So we're looking forward to connecting with you there as well. And again, we have our newsletter and our blog as well. And lastly, there's an opportunity to meet some of us in person. Linda, Darlene, and Erica will be in Detroit for MLA next week, May 16th through the 19th. So they'll be at the event, at the presentations, at an exhibit table. So come find them and give them a chat. And I think we do have time for questions. So if anybody has questions, we are happy to take those as well.
No questions?
We do have one about the slides, if we can share those.
Oh, sure. What's the best way to do that?
We could send them out to everybody who registered for this session.
And we also will have the recording on our website.
There you go. Thank you, Jacqueline. That's what I was looking for. How do we decide on the partnerships? Ramona, which partnerships? The ones that are not funded, just collaborative projects. I think people just, will hear that someone is interested in working with us on something, and we usually get back to them. And if it works, it works. If it doesn't, it doesn't. Is that what you meant?
Ramona, part of the, among the regions. I was going to answer the question about partnerships within Region 6 from our organizations. And, we have the mechanisms that make that possible with the partner outreach program and with the state advisory groups. And then also working with those who receive funding, but I'm not real sure about what you need with the regions. So if you can.
Yeah. So we have become much more national than we were in the past in doing some projects. We have national initiatives that we have the steering committee determined we would have. And so with those, there are 3 of them this grant period. They are the Misinformation, the environmental determinants of health, and the digital divide. And so we put out a call to all the other regions and offices about participating in things like in those kinds of subjects. And then we have interest groups that are formed sometimes. That's what happened with telehealth. And people could join that interest group among all the regions, and they come up with ideas of things that they want to implement, such as with the digital divide. The telehealth became the priority, and they came up with the class that they're going to be doing, and I believe a webinar series. I think I would also add that probably Region 6 reaches out to the other regions quite a bit. And we've been doing that, gosh, for the last 7 years to try and really push along this initiative that NLM wants to see a more of a national network as opposed to regional networks.
Also, I think there are so few people here. If somebody wants to ask a question, we can probably unmute you. So if you want to raise your hand, we can do that too.
If there aren't any more, we can wrap it up. I know there are lots of sessions today, so people will probably be happy to have a little break. Any of the staff have anything else you want to add before we sign off?
I would just say, if you want to learn more about any of the things that we talked about today, feel free to just reach out to the general email for the office, and we can get it forwarded on to the person who's leading that initiative and answer some questions.
Yeah, and just say hi to us in Detroit next week.
And all three of us, Darlene, Erica, and I will be working at the NLM booth. I have scheduled times. I can tell you what they were, but I don't know.
Thanks for coming, everyone.
Bye.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.